Hello. Today, we are going to talk about an important topic, personality disorders and how they are diagnosed. Personality disorders are serious conditions that affect individuals' thoughts, emotions, and behaviors, and it is crucial to make an accurate diagnosis. If you want to learn about this process, you're in the right place. Let's get started. Section 1. Importance of the diagnostic process. Although the exact causes of personality disorders are not fully understood, it is believed that they arise from a combination of genetic predisposition and environmental factors. Traumatic events in childhood, unhealthy family relationships, and genetic predisposition can increase the risk of developing personality disorders in some individuals. Additionally, personality disorders often coexist with other psychiatric conditions. For example, it is well known that individuals with borderline personality disorder frequently experience depression or anxiety as well. Personality disorders usually begin in adolescence or early adulthood and can affect many areas of a person's life. Therefore, it is very important to make an accurate diagnosis. A wrong diagnosis can lead to incorrect treatment methods. Psychiatrists consider many factors when making a diagnosis. Section 2. Evaluation process, detailed evaluation. The first step is for the psychiatrist to take a detailed medical and psychological history of the patient. In this process, information is gathered about the patient's symptoms, behavior patterns, thought processes, and emotional responses. This information forms the basis of the diagnosis. DSM-5 criteria. Psychiatrists evaluate according to the DSM-5 criteria published by the American Psychiatric Association. These criteria require specific symptoms and continuity for the diagnosis of personality disorders. For example, the DSM-5 criteria for antisocial personality disorder include: A. The problematic behaviors must have started before the age of 15. B. At least 3 of the following behaviors must be present: illegal activities, lying, impulsivity, physical aggression, lack of empathy, failure to fulfill responsibilities, unreliability. C. These behaviors must have resulted in a diagnosis of conduct disorder before the age of 15. D. These symptoms should not be attributable to another mental disorder, such as bipolar disorder or schizophrenia. Observation and interview. Interviews and observations with the patient help the psychiatrist evaluate the patient's behaviors and emotional responses. Symptoms of personality disorders usually start in young adulthood and show a consistent pattern. Section 3. Psychological tests and scales. Psychological tests and scales can be used when necessary. These tests help objectively evaluate the individual's personality traits, mood, and behaviors. For example, Minnesota Multiphasic Personality Inventory, MMPI. This standard test is widely used to identify personality traits and potential disorders. The MMPI consists of numerous questions that assess various psychological conditions and plays an important role in the psychiatrist's diagnostic process. Millen Clinical Multiaxial Inventory, MCMI. This test is specifically designed to assess personality disorders and helps understand the individual's personality structure. Beck Depression Inventory. This inventory measures the level of depression in an individual and provides information about their emotional state. Hare Psychopathy Checklist, PCLR. This test is particularly used in the assessment of antisocial personality disorder. Section 4. Functional impairment. Functional impairment refers to the extent to which an individual's daily functioning is affected. Personality disorders can cause significant impairments in social, occupational, and other important areas of functioning. For example, if a person constantly experiences conflicts at work or has persistent problems in social relationships, this is considered in the diagnostic process. Section 5. Determining other conditions. A careful evaluation is conducted to determine whether the symptoms are due to another medical condition, substance use, or another psychiatric disorder. The psychiatrist gathers information about the patient's overall health and conducts necessary tests to increase the accuracy of the diagnosis. Section 6. About personality disorder behaviors. Now let's address a frequently asked question about personality disorders. For example, does everyone who exhibits narcissistic personality disorder behaviors have this disorder? The answer is no. It is not accurate to say that everyone who exhibits narcissistic behaviors has narcissistic personality disorder. Narcissistic personality disorder is a condition that meets specific criteria. Some people may show narcissistic traits, but for it to be defined as a disorder, the symptoms must persist for a certain period and affect the individual's functionality. Therefore, just exhibiting narcissistic behaviors does not automatically mean that a person has narcissistic personality disorder. Section 7. Treatment process. After making a diagnosis, the psychiatrist creates a suitable treatment plan for the individual. This plan is tailored to the individual's needs and may include therapy. Different types of therapy, such as individual therapy, group therapy, or family therapy, can be applied. Individual therapy helps the person understand themselves and develop coping skills, while group therapy provides social support and interaction. Medication. If necessary, the psychiatrist may recommend medication. Antidepressants, anxiolytics, or other medications that help stabilize emotional fluctuations may be used. Behavioral interventions. Strategies to change negative thought patterns and teach coping mechanisms can be taught. Education and information. The individual and their family are informed about the personality disorder. This is an important part of the treatment process and helps the individual gain a better understanding of their condition. Conclusion. In conclusion, the process of diagnosing personality disorders requires careful and meticulous evaluation. Psychiatrists work hard to understand these important conditions that affect individuals' lives. If you or someone you know is experiencing such issues, it is important to seek help from a specialist. Thank you for watching this video. If you want to learn more about personality disorders, don't forget to subscribe to our channel. See you next time.